Alistair Woodward, thanks so much for making the time to speak to us today. The IPCC report this year puts quite a lot more focus on health impacts of climate change and looks at a lot of things in more detail. What are the new elements that we're looking at?
One of the new aspects to the report, I think, is its attention to what we call high-end climate scenarios. The fact is that the track we're on at the moment is taking us towards a world that might be 4 or 5 degrees warmer by 2100. So this time round, the IPCC has paid much more attention than it has in the past to just what the impacts would be of that degree of warming. 4 degrees of warming is something that's been regarded as a sort of an extreme outcome in the past. We're looking at conditions that will put food supplies under enormous pressure, lead to very frequent and very severe heat waves in many parts of the world, will put enormous pressure also on the control of infectious diseases. So major challenges really for public health services is what we associate with change of that degree. The other point that we make is that 2100 is not really that far away. It's been regarded as something that's over the horizon. But if you think about the lifespan of a child born today, the median life expectancy of a child born in Hong Kong or in New Zealand is around about 85 years. So basically the citizens of the 22nd century are with us already. And that means that the kind of world that we leave for them in 2100, it's a matter of within generation effects rather than between generation effects.
You mentioned in your presentation earlier that human beings have hard limits in terms of what they can physically endure, and one of those hard limits is around 39 degrees, and after that we're not in our environmental sweet spot, and the consequences are quite dramatic. So maybe you could just talk a bit about those impacts.
Yes, the humans have got a physiology that is not going to change in the next 100 years. And one of the important aspects of the way our bodies work is that we have to get rid of heat. We have to keep our body at around 37 degrees body temperature. The way we do that essentially is by sweating, and so if the temperature of the external environment rises sufficiently, particularly if it's very humid so that the sweat won't evaporate, then we get into difficulties, and that of course is when you get heat strain and then heat stress. You commented on the 39 degree figure. That's right, it's 39 degrees using something called the wet bulb globe temperature, so it's about 46 or 47 degrees in the usual way of measuring air temperature, assuming humidity is about 20%. So those circumstances don't occur very often these days. They do in some parts of the world, but not very often. However, if you project ahead into the future, and as I said, take these high-end climate scenarios, just as an indication of the kind of challenges that our grandchildren will be facing, then parts of the world, including the tropics in Asia, will have those kinds of temperatures for parts of the year, which will effectively make it impossible for people to carry out outdoor activities of the kind that at present we take for granted.
Another consequence of climate change, and in fact we're already seeing this, is old diseases making a comeback. You're talking about the re-arrival of dengue fever in Europe, for example. How is that going to run, and what can we do about it?
We have made enormous progress in the last 50 years all around the world, in Europe and in Asia, in terms of controlling the old diseases that you mentioned, like malaria and dengue and cholera and so on, all of which are sensitive to climate. What's happened in Europe is that the services that were controlling those diseases, the mosquito control services, primary healthcare services, have been degraded recently as a result of economic difficulties in countries like Greece. And what's happened when attention's been relaxed is that these conditions, malaria and dengue, have reasserted themselves. So it's a very important reminder that we can't take our progress for granted. We've got to continue to pay attention to these threats, particularly as the climate becomes more suitable and supportive for conditions like that, like malaria and dengue.
I know that one of the key concepts here is about co-benefits. It's about doing stuff now, which can certainly have a long-term dividend, and it's still stuff that you need to do now anyhow. But maybe we could just explore that a bit.
Yes, this is the idea of making wise climate choices that will reduce the risk of serious climate change in the future, but will also bring benefits in the shorter term. We think those are very important as a way of gaining political support for making changes that won't bring climate dividends in the short term in terms of the next electoral cycle, but well chosen will bring benefits of other kinds, including health benefits.
Such as?
Yeah. Well, a good example is choosing transport systems that reduce dependence on private motor vehicles, that reduce the consumption of fossil fuels, reduce emissions, and at the same time improve air quality, and quite importantly in communities which are increasingly sedentary, provide people with more opportunities for physical activity, which is a very important source of good health.
Alistair Woodward, thank you so much for your time.
Thank you.